Hello and welcome, I'm Dr. Nathan, and today we're going to be discussing disc bulges as part of our educational series. So let's begin with the anatomy. In your spine, in between each vertebrae you have a disc. So there's 23 discs within our spine, and what these do is resist compressive forces. They're kind of like, think of a shock absorber, that's their role. Now, as we move the spine, they're prone to injury. So it depends on what type of injury. So if you were to have, a trauma or a major accident, these discs, they're prone to injure themselves, and when they injure themselves, they might prolapse or they might start to bulge out. And if they bulge out, sometimes you can press on the nerves. Okay, it might be a repetitive injury, and this is what we see day in, day out in practice. So some people, it's a repetitive motion, whether it's at work or their sporting events, where it's just prone to injuring the disc, and if you do that enough, then it tends to prolapse. Okay, now it's estimated that 7 out of 10 people have a prolapsed disc. Okay, but they're not always symptomatic. So some people are walking out with an asymptomatic disc. Okay, based on the research that you read. Now, the thing is, the people that are symptomatic, what they tend to feel is first numbness or tingling. They also might find burning sensations throughout their body. Okay, now if this progresses, some people, if it's left there long enough, if it's severe enough with the prolapse, if it's touching the nerve long enough, the muscle wasting will come into effect, and that's where you'll start to notice weakness of muscles as they start to, it's called atrophying, and that's where the muscle basically starts to waste away. Okay, now in terms of your management options, you've got a few options. Basically, you can look at it conservatively, and that's where basically you look at, if you were to go down the chiropractic route, you're looking at basically distraction forces to really bring out that spine and to allow that disc to suck back in and heal. And then also mobilizations and gentle adjustments. It depends on what phase and how severe you are. Okay. Now, if you are severe, if you want to get out of pain quickly, or if conservative treatments just aren't working, then you might be looking at the medical pathway, which might be anti-inflammatories or painkillers. If it's really bad, you might be looking at surgical opinion. Okay. Now, if you'd like to know more, or if you have any questions, feel free to call us. You'll find our number in the link below. Thank you.